Hello, I'm Todd Robbins, owner of Robbins Rehabilitation. We are a privately owned physical therapy practice here in the Lehigh Valley, and I wanted to talk to you today a little bit about what's called direct access. So many people don't know about this, lots of doctors don't know about it, but certainly the general public has very little information on this, and it's something that's important to get across to you if you're trying to figure out what you need to do. Do I need physical therapy? Do I need to go to my doctor? A lot of people have questions about that. So in New Jersey and Pennsylvania and every other state in the United States at varying degrees, there is what's called direct access to physical therapy. What that means is that you do not need a prescription or a referral to start physical therapy. And that's really, really important because a lot of people feel like, well, I need something written by my doctor in order to get started, and maybe I'll go through that. And this is really why it's important, is because in the normal course of care, someone wakes up and maybe they have a pain in their back, okay? What typically happens? Well, a lot of my patients will call their doctor and make an appointment. So maybe they wait a week maybe to get into the doctor, and they go talk to maybe their general practitioner. Now, a general practitioner has a really, really hard job. They have to know, a lot about all different conditions that can affect, the human body. They get maybe a week's worth of orthopedics in school. That's not where their focus is in. So if you're having an orthopedic problem or a problem with your bones, your joints, your muscles, they just don't have the amount of training that a physical therapist does. Keep in mind, all of our physical therapists are doctorate level trained. They all have their doctorate in physical therapy. It's a lot of education, okay? Sometimes 7 or 8 years to get to that point where you are a physical therapist. We are uniquely educated to diagnose and treat orthopedic problems that are happening with your bones, your joints, your body. That's what we went to school for, to get to the point of what's going on. So that's what we do. Many patients say, well, how do you know what to do if you don't have a script from a doctor? I very rarely read the prescription from the doctor. The doctors send people to us now to just evaluate and treat. They know that we know what we're doing, but I don't need that information from the doctor. We do our own evaluation and find out exactly what you need to get better. So going to the doctor may not be the best option for you. Then you go to the doctor. The most common thing that happens at the doctor's office when you're having an orthopedic problem is you're prescribed drugs. Okay, you're given a chemical solution to most likely a mechanical problem. It helps with symptoms, but it doesn't fix the problem that you have. But very commonly, patients will tell me, yeah, well, my doctor said take this medication for a month and come back and see how it feels. So they come back, maybe they have less symptoms, but they're not fixed. They don't really have the problem, taken care of. Well, maybe we need to get an X-ray or an MRI. So then you got to go schedule a test, go pay for the test, and then come back, take a look at the results. Well, we're not quite sure. Maybe you should go to a specialist. So maybe you go to an orthopedist. Orthopedists are very busy people. The patients that I talk to average somewhere around 90 seconds to 2 minutes with the doctor. Some are longer, some are shorter, but you're not getting a whole lot of time. It's very challenging for that doctor to really diagnose anything in that short period of time. But when you make a direct access appointment or just schedule with a physical therapist, you're going to get one-on-one time. You're going to get a full evaluation. You're going to get over an hour's worth of time where you're working with that therapist to find out exactly what's going on with you. Other good thing is you don't have to wait long to get in. Most of our patients that call can get an evaluation in our offices within 24 hours, depending on your schedule. It's proven through a lot of research. The sooner you start addressing a problem that you have, an orthopedic problem, pain in the shoulder, pain in the back, pain in your foot, the sooner you start getting treatment in physical therapy, the sooner you're going to get better, and the faster you're going to get better. The more it hangs on and you make appointments with the doctor and do other things and don't start treating the problem, the longer it's going to take to get better. So direct access is a great way to access physical therapists and get started on feeling better right away. But it's very often misunderstood. So again, you don't need a prescription. You don't need a referral. You can just call our office and we'll get you set up for an appointment so you can come into our office and start feeling better today.